In a new report, the Congressional Budget Office estimates there will be 22 million more uninsured Americans by 2026 under the Senate health bill. Earlier today, Republican leaders revised that bill. Joining us now is Chris Jacobs, Senior Healthcare Policy Analyst at the Texas Public Policy Foundation, a conservative think tank. Thanks for joining us.
Great to be with you.
Under this new provision, people who have had at least a 63-day gap in insurance in the past year would face a 6-month delay before it would take effect. Now, it's meant to discourage healthy people from getting off of their health care. Will it work, in your view?
We don't think so. We think the answer is really to repeal all of Obamacare and all of the regulations and the mandates that have driven up premiums associated with Obamacare. Premiums have more than doubled in the past 4 years since Obamacare went into effect. The bill, as currently constituted, would effectively repeal the individual mandate and set the penalty to zero, but it would leave all the regulations in place. And that's a recipe for destabilizing the insurance markets. It's also a recipe for continued higher premiums, and the American people need relief.
Well, you've written a paper, Top 10 Reasons Why This is a #fake repeal. And for you, the number one reason is what you're saying, the bill retains these insurance subsidies. What does an effective repeal, in your mind, look like?
Well, I think an effective repeal would repeal the subsidies and more specifically the regulations that are driving up the premiums.
What are those?
Primarily, it's the guaranteed issue, it's the community rating, it is the federalized approach to Washington. We've also said if states want to reimpose those regulations at the state level, let them do so. We believe in federalism, the 10th Amendment, states' rights. If states want to do that, some states had these regulations in place prior to Obamacare.
There's language in the Senate bill defunding Planned Parenthood. Pro-life advocates think that language is going to be scrapped. How likely is that?
Hopefully it won't be scrapped. We have tens of thousands of community health centers around the country that can provide quality care. We don't need to be giving funding to the nation's largest abortion provider.
Okay, thank you so much. Chris Jacobs, Senior Healthcare Policy Analyst at Texas Public Policy Foundation.
Thanks for having me.